A new day for healthcare in Minnesota. What if we could improve healthcare for all Minnesotans? The University of Minnesota and Essentia Health are setting out to do just that by creating a not-for-profit healthcare entity that supports the needs of patients now and the healthcare demands of the future. How will it serve all Minnesotans? For Minnesotans, it will deliver world-class research that advances treatments and cures, ensure a prepared and exceptional healthcare workforce, and overcome Minnesota's most complex healthcare challenges. For healthcare employees, it will provide resources for fulfilling careers, create a culturally aligned system, and promote innovation and improved patient service. For University of Minnesota students, it will provide an enriching educational environment with healthcare mentors, maintain excellence in health science programs, and create a statewide network for learning, training, and employment. For providers, it will grow a platform to support all patients, foster a vibrant health sciences learning environment, and continue Minnesota's tradition of clinical research and discovery. For patients, it will provide accessible care across Minnesota, improve recruitment of rural providers, and bring specialty health care closer to home. The patient is at the center of this new path forward. Let's hear a real story about how this vision will benefit them from a patient who is experiencing care in Duluth and the Twin Cities.
She's always been very independent, very much I can do it myself.
Strong-willed.
Very strong-willed, yep. But also someone that if she sees someone in need, she'll go right over there and help them.
At end of January in 2024, her heart was racing. She was getting tired, and we checked we took her into a clinic. It was that night that they diagnosed her with leukemia. It was just hard because all the different options and treatment paths. The medical team here at Essentia was really good at bringing us into that discussion.
Initially, this leukemia looked pretty straightforward, and then through the course of getting treated, it kind of had some unique properties to it. And this was a collaborative discovery. You know, our pathologists here, our other oncologists here, along with the university, kind of looked at this case as being a little unique. So because of the partnership that we have, all of the chemotherapy that Catherine needed prior to the transplant was given here. Why that's important and why the network of how we worked with the university is so great is that she didn't need to get all of that initial chemotherapy done far from home.
We added up about 5 months in Duluth, and in July we transferred down to U of M. She went through radiation and the transplant.
We have a larger family, we have 6 kids, and when all of a sudden you're all alone in a room and you have all all these treatments, and it can be a struggle. They were trying to get her into remission so she could get a bone marrow transplant. Our oldest daughter ended up being 100% match. That was pretty exciting. Mm-hmm. Doctors were excited, and they hadn't had that for a while.
You end up knowing so much about these kids. The resiliency of Catherine, I think, is the biggest, and just how much her family loves her and how much she just wanted to be a regular kid through all this. Medicine to me has always been about people. I mean, I'm a pediatric oncologist, but I feel like I'm a weird uncle to hundreds of kids. The goal was always about taking care of Minnesotans. The goal was, how do we get patients in rural areas? And I was very upfront that I wanted to be a pediatric oncologist. I went to medical school at the University of Minnesota Duluth for the first 2 years, and then finished my medical school training at the University of Minnesota. I wanted to stay at one place, and that was pediatric residency at the University of Minnesota. The thing about us is that we work with the University of Minnesota, and these patients are essentially, we're all one unit unofficially because we work with them. So you're getting the same care if you were down in the Twin Cities or if you were here.
It was very nice knowing that that's where Dr. Perko studied, and him and Dr. Hoover had a very nice relationship, and they would be able to talk back and forth and discuss things over with each other.
I am very grateful for the care that we have right here where we live in Duluth. We just had her 6-month post-transplant checkup down in Minneapolis in January, and she's been cancer-free for 7 months.
When you see that M, that means something. Now you have this opportunity of like, we're going to combine with this group and maybe be part with this group. That's really exciting because there's ownership of this is for Minnesotans. I've never seen physicians more positive, more enthusiastic, and that says something. I think we're just scratching the surface with what we could do with medical education. I mean, sky's the limit there.
Together, we must meet the critical needs of today and anticipate the demands of tomorrow. It is our duty